Assalamualaikum. Today I'll be teaching you ureters from the anatomy class, and we'll be doing our board. Let's get to the board as fast as we can without wasting any time. So your ureters, you need to know the course, the relations, and the constrictions. For the course and the definition, you need to know that your ureters are muscular tubes that transport urine from your kidneys, right here, from your kidneys to your urinary bladder. These are your ureters. And about their length, they are about 10 to 12 inches in length and 25 centimeter in length. The diameter is 3 to 4 millimeters. You don't need to know that. And due to their length and the constrictions that they have been compared with another muscular tube in your body that is the part of your GI system, the esophagus. Now we are done with the definition. Let's move towards the course. They begin at the renal pelvis right here, and this is the funnel shaped area within your kidney, and they descend retroperitoneally, that is behind your peritoneum, into the pelvis, where they finally enter the urinary bladder. On their way, if you see, these are the transverse processes. Yahan par you have your vertebral bodies. This diagram's better. If these are your vertebral bodies, they cross the lateral transverse processes, and then another point of crossing is the common iliacs. They cross the common iliacs. First was the renal pelvis. Second was the lateral transverse processes. Third is crossing the common iliacs. And fourth is just when they enter the pelvic brim. What's the pelvic brim? We have this diagram right here. This diagram. Pelvic brim is this structure which basically differentiates the false pelvis from the true pelvis. And this is the point where they kink. And then they enter the bladder at this point, the intramural part, which is also called the posterior-superior aspect of your urinary bladder. So we are done with the course. The lateral processes. PUJ, your pelvico. No, sorry, we cannot do this way. हर चीज लिखनी होती. Okay, let's move on to the constrictions. Where are the constrictions? The number one constriction is shown in blue. This is at the PUJ, the pelvis and the ureter junction. This one right here. This is the first constriction. The second constriction is right here. Can I use a purple pen? So the first constriction is this. The second constriction is right when the kink, right when they enter the pelvic brim. And the third one is here. The intramural constriction when they enter the bladder wall. So let us write the constrictions. Number one, the pelvico-ureteric junction. Number two, right when they enter kink, they kink and enter the pelvic brim. And third is intramural in the bladder wall, right when they enter the pierce the peritoneum to enter the bladder wall, intramural. Constriction ho jati hai. Now moving on to the relations. I used my dear friend Hasna's mnemonic here. So relations, in the renal pelvis, you have your renal veins. Outside the kidneys, you have interiorly your renal veins, and posteriorly your trusty psoas major muscle. In the abdomen, since there are two ureters, so you have to do two relations. On the right side, the mnemonic is drip, and on the left side, as PSL is happening, the mnemonic is PSLG. G will also come here because there are right and left gonadal arteries. And posteriorly, these are the posterior relations, and then these are the medial relations, and then this is your pelvic relations. Renal pelvis pe you have your renal vessels. When you come out of the kidney, right here, when you come out of the kidney, you have renal vessels anteriorly, and posteriorly you have this big muscle, which is basically your sauce major muscle. Abdomen में right side पे you have your duodenum, your right colic artery, your ileum and ileocolic artery, and peritoneum of the small intestine, and also your gonadal arteries. And on the left side, you have peritoneum, the sigmoid mesocolon, the sigmoid colon itself, the left colic, and the left gonadal artery. In the pelvis, you have the ductus deferens, and the broad ligament of uterus and the uterine artery. You have to remember this mnemonic crosses over the ureters. Sorry, I have written uterus, ureter. The ductus deferens crosses over the ureter. The uterine artery crosses over the ureter. Hence the mnemonic that water, that is urine in the ureter, is under the bridge. The bridge here, it could be ductus deferens. Now coming to the posterior relations, on the right side, you have your right psoas major and bifurcation of the common iliac of the right side. And on the left side, posterior relations are psoas major of the left side and bifurcation of the common iliac artery on the left side. And medially, you have your inferior mesenteric vein. I think we are done with the relations. Coming towards the best part, we divide your ureter into three parts: the upper, middle, and lower part. The upper part has an arterial supply from the aorta by the renal artery and is drained by the vein of the same name, that is renal vein. The middle part is drained by the gonadal arteries, testicular artery in males, and ovarian artery in females, and is drained by the veins of the same name. And the lower part is drained by the superior vesical artery and is drained by the veins of the same name. The lymphatic drainage is usually para-aortic, or you can say the lateral aortic lymph nodes, right on the lateral sides of the aorta and also on the lateral sides of the iliac vessels. So they drain to the lateral aortic and the iliac lymph nodes. And when you come to the nerve supply, the parasympathetic nerve supply is by T12 and L1 and sympathetic by S2 and S4. But in your Snells, they have only mentioned the plexus. The upper part is supplied by the renal plexus, the middle part by the gonadal, that is testicular in men and ovarian in female plexus, and hypogastric plexus supplies the lower part of the ureter. Clinicals के अंदर you need to know that since they are retroperitoneal, so they are very protected. And if someone comes to you with the the ureteric colic, which is basically pain in your loin, groin, and the flank, you do a plain radiograph. If the stones are not opaque, these stones usually get stuck at those 3 constrictions. In some book, there are mentioned 5 constrictions, but in your Snells, they have mentioned only 3. What are they? The PUJ, pelvic brim wali, and the intramural, जब bladder wall के अंदर आ रही होती है. इस point पे आपके stones आकर फंस जाते हैं, get arrested at these points. So, if plain radiograph पे आपका ureteric stone नहीं आ रहा, तो you do a CT and an intravenous pyelogram. Okay. That's the procedure. Renal colic pain will be in the loin, groin, flank, and will be referred to the loin, the groin, the flank and these would be the dermatomes T11, T12, L1, L2, carried by the femoral branch of the genitofemoral nerve. That's about the clinicals, and I think we are done with the ureters. The next topic would be your urinary bladders, and you can take a screenshot of the notes if you want. Thank you.